Now we will show you how actually this PRP in the knee joint is performed. We will tell you the step-by-step procedure. It is happening in our clinic for our patient. She is around 60-65-year-old lady suffering from the knee pain since long. We are about to inject the PRP, anesthesia. We are about to inject the PRP in and around the joint. So we have just seen the procedure, how it is done. We have just done the PRP for the knee joint pain. We expect a little redness and a bit of numbness around the in and around the knee joint for quite a few hours, or maybe extending to the day. We do not expect the patient to work or any kind of strenuous activity for at least next 24 hours. We advise the patient to take rest and wear knee caps for at least for next 7 days. Usually the patient mobilizes and can do its own routine activity after 24 hours. And the pain relief usually starts after the third day, yani after 72 hours pain relief start happening, and it may peak up to 3 weeks.